Hello.
Opo.
Hello. Mama's here.
Good afternoon.
Good afternoon. Kumusta na?
Okay lang po. Okay lang yan. Wala yata si Candy, Cindy, ma. Wala si Cindy yata. Yata.
Okay, do I transfer? How do I transfer? Ano ba? So, who are here now?
Bali tayong apat.
Daisy won't join.
Daisy, you join.
Mother? Meron ka palang ano doon? Winter melon tea. Ano na? Yung winter melon tea mo. In the fridge. Edamame. Edamame. Ha? Ano nangyari sa'yo?
I slide on my socks.
Yun ang sinasabi ko. How about me? Ako nga nag-ano to
Ano?
Yung
Nag-invite
socks.
ako may heater kasi ang lamig dito.
Nasaan?
Bibili
Nakakita
na
ka?
ako. Hindi the same. Wala na.
The same na ganito?
Maybe. Kasi ito nahulog eh. Maybe it's a defect lang or what?
Baka naman may defect. Anong sabi?
Nothing. Hindi sila nag-reply kasi bili na. Kaya bili na lang. Kasi the other ones dito, I don't know the brand eh. Kaya nakakatakot. O yun no. Black and Decker lang.
Black and Decker, hindi ba? Isang brand.
Yeah, that's the only one nga I know. The other brand, ayun, Hamcow. Hindi ko naman alam yan. Hamcow.
So I think we'd better start. Anyone more? I mean, anybody comes? It's coming. Anyone more?
Si Madge.
She's not answering.
Tinatawagan namin ni Sophie si Madge. Hindi yan sumasagot.
Kasi mag-i-id siguro, ma'am. Baka feeling na siya ng id na. Nagpi-feeling id na siya ngayon. So, sino nandito? Si Joseph. Tapos, kayong dalawa. Sino pa? Anybody? Anybody more?
Sino po nasa picture?
Hindi ko yata ma-enlarge itong aking ano. Wala. So, tayo lang.
Opo.
Wala man sinabi yung iba na they will not be able to come to attend.
Si Cindy, ma'am, si Cindy ba yun? Sabi niya, meron daw siyang ginagawa tungkol sa visa niya.
Sino?
Cindy ba yun? Good afternoon po. Baka hindi po ako maka-attend ng class today. May aasikasuhin lang po ako sa visa ko.
Oo.
So,
Yeah.
Nabasa ko rin nga po yun. Hindi ko lang, nakalagay lang kasi doon na Ate Luming, di ba, non yung pangalan, no? Non.
Pero ang pangalan, sabi ko nga kahapon, sabi ko, anong pangalan? Cindy yata pangalan niya, Cindy?
Oo.
Cindy nga po.
Kasi wala nga pangalan kasi kaya hindi mo ma-identify kung sino.
Akala ko pangalan niya, Noni. Sabi ko, Noni? Oo nga talaga. Sabi ko, ano pa pangalan niya, Noni? Sabi ko yung pala. Hindi po, Cindy.
There is no other. Wala naman. Siya lang naman. Bakit yung the rest? If they will not be able to come, sana nagme-message sila ahead of time. Para alam natin kung ano ba, 3 lang talaga tayo or ganito.
Tama.
This is different. Check mo kung maganda.
So if not, yan, sino siya? Sino si girl? Kasi nga, sabi nga ni Ma'am Maricar, dapat ilagay yung pangalan talaga. Para at least we will recognize sino sila. Si baby girl. Sino si baby girl? Sino si baby girl?
Good morning, ma'am.
Hi!
Hi, Ma'am Ann.
Hello!
Ay, wala po pala akong video.
Wala ngang video, kaya hindi ka namin...
Ito na po.
Oo, hi, hello. Dapat yung pangalan mo kasi, hindi ba sabi ni Ma'am Maricar, pwedeng palitan yan?
Ay, opo, sige po, no, papalitan ko po.
Yeah.
Opo. Baby girl.
Baby girl kasi.
Pasensya na po, sige po, papalitan ko po.
What
So,
building?
sino pa yung ating baby boy? Wala naman? The only boy pala si Joseph. Yeah.
Nasa bahay po ako ngayon, wala po sa school.
Okay. Oo. Naka-coat ako kasi malamig, masyadong freezer dito sa bahay.
Ang ganda naman po, ma'am.
Malamig eh. But I am in uniform. Naka-uniforme kaya ako.
Ako po, by next meeting, hopefully, meron na.
Okay, oo. Sana soon tayo magkaroon na sa class. Doon na tayo sa sa class na tayo.
Palitan ko.
Well, walang nag-announce na hindi sila talaga makakarating or something. Kasi if not, dumiretso na tayo. We'll go on kahit na 4 tayo. Okay lang.
Na pag just in case kung hindi nila alam ang protocol, at least inform sila pag
Kasi alam nila pagka wala sila, by that time, sana ay nagsasabi na I will be 10 minutes late or kagaya itong si Cindy, si Cindy, nagpaalam siya para hindi siya hihintayin. So, out of ilan kayong nag-start?
I don't know. Ba
Kayo
tayo?
na nag-start. So, you started with 9. So, we are only 4 now. 4 na lang.
sayang yung information.
Anyway, talagang ganon. Meron sila, wala sila. If you really want to complete it, kahit na pa nag-iisa ko, I don't mind, di ba? Ganun lang yun. O sige, mag-umpisa tayo. So, welcome everyone. Magandang hapon.
Magandang hapon din po.
Magandang hapon ulit. So last time, we were talking about infection control. So sabi ko, magkakaroon tayo ng assignment about it. So, meron ba tayong pin-repair? You have prepared something about infection control? Just to
Yes.
let us know kung ano yung understanding nyo about infection control. At least there is something na you want to share, yung information or any research or anything that you have taken from your research. Okay? So we'll start with our boy.
Wow.
Meron tayong 1 man dito. Okay?
Talagang ine-expect ko talaga yun. Mauuna.
Alam mo, nakakatuwa nga, in every class, talagang may isang lalaki. Oo, bakit isa? But siguro during the time ng enrollment, siya yung nandun sa group. Parating may isang lalaki sa group.
Opo.
Sige, Joseph. We want to hear from you.
Yes, ma'am. Ano naman, 2 pages lang. Actually, marami po. No? Tapos, marami rin ako nakita based dun sa binigay nyo ng mga references. And some of it are downloadable. Kaka-research mo nga, nada-download mo na. Pero sabi ko, nung na-download ko siya, it seems that 156 pages. Sabi ko, ang dami naman ito. Pero I just gather only those, yung informative tsaka yung easy to understand. Right? So, infection prevention and control, I gathered this at World Health Organization. Is a scientific, did you hear me po loud and clear naman?
Okay naman.
Okay. It's a scientific approach and practical solution designed to prevent harm caused by infection to patients and health workers. It is grounded in infectious diseases, epidemiology, social science, and health system strengthening. IPC, or the Infection Prevention Control, occupies a unique position in the field of patient safety and quality. Universal health coverage, since it is relevant to health workers and patients at every single healthcare encounter.
Okay.
No country, no healthcare facility, even within the most advanced and sophisticated healthcare systems, can claim to be free of the problem of healthcare associated infections. The
That is
need
high.
of the need of having IPC programs, nationality, and at the facility level is clearly reinforced within the World Health Organization 100 Core Health Indicators list. Yun nga po yung downloadable na yon, yung mga indicators list na yun. The IPC Global Unit will deliver its work based on 5 main functions. 1, leadership, connecting, and coordinating, which is yung mga nakaraanan natin, pinag-aaralan din po natin talaga yung pagiging leadership na nga, connecting mo, tsaka yung coordination mo with your colleagues. Campaigns and advocacy. Number 3, technical guidance and implementation. Number 4, capacity building. And number 5, measuring and learning. Tapos, nakuha ko rin po dito naman sa JCIA, which is here na in COVID pandemic, aims tsaka yung objectives niya, which is know that infection prevention and control is everyone's responsibility. Kahit hindi ka po, ibig sabihin, kahit hindi ka na sa medical institution or hindi ka, or ano ka man, responsibilidad ng lahat na maging healthy tayo. Practice proper hand hygiene. Apply standard and transmission precautions. Follow the correct process for the wearing and removing of personal protective equipment o yung PPE. List the steps to follow in case of occupational exposure to blood and body fluid. Be aware of waste segregation and disposal. Yun yung pinag-aralan din po natin. Understand the role of environment, cleaning and disinfection. And lastly, have vaccines. So, nakuha ko po yan sa the Joint Commission International Accreditation Standards for Hospitals. Yun lang po.
Okay. Thank you for sharing with us. Very informative. Okay? So, yun ang gusto kong mangyari. Not only yung kukunin nyo yung buo na nakasulat doon, but yung summarization noon to know kung ano talaga yung na-understand mo. So, yung summary doon sa sinabi mo ngayon, ano yung na-understand mo?
Yung isa is yung know that the infection prevention and control is everyone's responsibility. Sabi ko nga po kanina, yung number 1 yun. Yung, kasi itutuon ko na lang din muna ito because of the COVID pandemic, no? For at least, kasi ito na yung nararanasan din natin. Tsaka yung ano nga po, yung proper hand washing. Hindi lang basta hugas talaga ng kamay. Kumbaga, ang binabanggit din dito for the prevention control din ng ano natin is ano man yung mangyari, meron man magkaroon man ng hindi man pandemic din, meron mang epidemya din na nararanasan, or kumbaga kapag nasa loob ka rin ng isang health facilities or yun nga, nasa hospital ka or nasa clinics ka, hindi lang basta tawag dito, hindi lang basta siya yung talagang parang pag nandun ka na i-observe talaga din yung kalinisan, tsaka napiprevent ng gusto na nandun na. Kasi when I was young, tsaka meron din akong nakikita rin ngayon, yung may mga bata or iba yung parang natatakot pumunta ng hospital. Parang pag napunta ka ng hospital, ay baka mahawa ako. Tapos baka yung parang ialis yung ideology na yon na tipong pagka nandun ka kasi is hindi naman talaga doon nga inaalagaan at tinitreat natin yon, tsaka hindi nakakatakot ang isang health facility or isang hospital. Yun lang po.
Yes, yeah. Good. But dun sa sinabi mo about yung concept ng mga bata na natatakot pumunta ng ospital, yeah, as per doon sa ating mga evidence-based references, talagang nakakatakot sa ospital. Number 1 yon. Kaya nga, doon sa pag-uusapan natin about infection control, yung healthcare facility or i-consider natin na lahat tayo without knowing anyone na free or clean. Basta, yung everyone, you should consider, pagpasok mo dun sa ospital, you should consider them as potentially infectious. Para din, ikaw parating maging free, maging safe. Yun, potentially infectious. And the other one, regarding yung sabi mo sa concept yung mga bata, na talagang pinagbabawal as per standard yan, bawal ang bata sa ospital, not unless may sakit. Kasi sa hospital, lalo na yung mga long-term hospital, dun tayo kumukuha ng high, yung healthcare acquired infection. Kaya yung mga pasyente mostly, if they are long staying, nakaka-acquire na nga sila eh. Wala silang sakit, but within yung dun sa long staying nila, doon nakaka-acquire na. Okay? So yun yung mga tinatawag na healthcare acquired infections. Okay? So good. Thank you for sharing with us. Very informative. Oo. Si ano naman, tawagin natin si, ano na ang pangalan nito? Si baby girl. Si baby girl. Okay?
Nakaano ka? Walang marinig.
Wala kaming naririnig pa.
Ayan. Ayan po,
na.
meron na po.
Okay, yeah. Go on.
Ay, ma'am. Kasi po parang pareho lang po kami ni Joseph ng na-research.
Okay.
Infection prevention and control, scientific approach and practical solution designed to prevent harm caused by infection. And then patient and health workers. It is grounded in infectious disease and epidemiology, social science, and health system strengthening. IPC occupies a unique position in the field of the patient safety and quality universal health coverage since it's relevant to health workers and patients at a very single healthcare encounter.
Okay.
No countries, no healthcare facilities. Is this the one you reported, Joseph?
Yes po.
Pero
nagdagdag ako dun ng dun naman sa JCIA. Dalawa yung reference ko, JCIA at World Health Organization.
Okay.
It's okay naman yun. Kasi nga, even yung makita, yung ma-research ni Joseph, ma-research nila. Kasi nga, iisa lang yun, yung standard pagka sila naglabas ng mga standards nila. Iisa lang yan. So kahit na pumunta ka ngayon sa Amerika, pumunta ka sa Euro, iisang pag-uusapan natin. JCIA.
International po talaga.
CDC yan. So isa lang yun. So madadagdagan o makukulangan man the way na statement natin with that statement na bago. Yun lang yun. But yung root is still there. Okay. Thank you. So what
Thank
about
you
si
po,
Ma'am Paraluman at saka si Sophie?
Kasi ma'am, ang ginawa ko na lang din, since sabi nga, ginawa ni Joseph, nag-copy and paste lang ako ng mga important points, like what is infectious diseases. Infectious diseases are caused by pathogenic microorganisms such as bacteria, viruses, parasites, and fungi. Fungi. Meron din pong another kind of infectious diseases which is called zoonotic diseases, which is example po yung ating itong COVID-19. These are infectious diseases that initially are from the animals, and then when it goes to the people, it becomes cause them diseases. Napag-alaman ko din po yung mga ways of transmission of infectious diseases, which can be foodborne, waterborne, ayun pong nanggaling po sa, it can be transmitted through food, through water. Pwede din po matransmit ang diseases through vector-borne disease by insects, tsaka po yung mga
Vector
disease.
is yung mga mosquitoes, ma'am.
Malaria po, yung malaria po ba yan, ma'am? Tapos meron
Malaria
din
is from mosquito.
po blood-borne diseases like hepatitis, and then meron din pong airborne diseases like COVID. Tapos
Tuberculosis, COVID.
tuberculosis po. Marami po kasing mga in-enumerate na diseases ang World Health Organization na infectious.
Sabi ko nga sa inyo, oo, pagka ibinigay ko yung the most common is 100 plus. So paano natin siyang
Kaya po,
enumerate mo yung 100 plus na common?
ang dami
Okay?
na po. Opo. Tapos, meron din pong sinabi dito na isa based on, kasi ang ibig sabihin po pala ng JCI is Joint Commission
International Accreditation
It's
of
a US-based
America.
non-profit tax-exempt organization that accredits 22,000 US health organization and programs. Ang CDC po naman is Center for Disease Control and Prevention. It's a national public institution in the United States, it is a United States federal agency under the Department of Health and Human Services. Tsaka po yung mga information na ibinigay ni Joseph din.
Yes.
Yun po.
Yes. Yeah.
Ma'am, meron ba po ako
Very good, ma'am. Good enough.
Okay, thank you. Yun po. Meron din po isang information na medyo narito po ako kasi meron din pong binigay ang CDC, yung mga infectious diseases which is brought by, for example po, yung pong to assist yung mga pasyente paglalagay po ng mga ventilator, paglalagay po ng yung po yung mga infectious diseases na nakukuha ng mga healthcare provider, like naglilagay po ng ventilator, naglilagay po ng mga tube. Meron din po ako nakuha tungkol doon. So
Ventilator-assisted pneumonia, ma'am.
yun po.
Yung mga nakukuha nating pneumonia because of the yung matagal na nakalagay sa ventilator yung pasyente.
Yun po.
So sila yung nakukuha natin yung sakit through that. So yun. Yun yung mga kasama sa mga healthcare acquired infection. Nagkakaroon na lang na infection dun sa loob ng ospital. Nag-a-add. Sorry, na-a-add yung infection sa kanila. Ganon.
Yun po ang nakuha ko.
Good information, ma'am. Marami ka. Napakarami. When you dig up, talagang marami kang malalaman. Hindi ka makakahinto dahil napakaraming references. Oo. Thank you. What about Sophie?
I think I misunderstood the assignment. I looked up a disease actually, and how it was, for example, how the World Health Organization deals with it and is preventing it. And the one that I looked up is actually ironically quite similar with COVID in it that it's the natural host of this virus is actually fruit bats. It's called the Marburg virus disease, and it was initially detected in 1967 after simultaneous outbreaks in Marburg and Frankfurt in Germany, as well as in Serbia. And there is no vaccine to it. It's just interventions. So basically case management, surveillance, and contact tracing, a good laboratory service, safe and dignified burials, and social mobilization. So yeah, I just looked up an example of how, for instance, an organization would deal with an outbreak of a disease. And in this instance, it's the Marburg virus disease. So it's a bit different in research.
Yeah. Good. Good information. Additional information with COVID pandemic. Yeah. Actually, this COVID pandemic nowadays, yeah, we have, just like the other day, I think I read an article from the CDC. It was the update from the CDC regarding the symptoms. They added, or they found out that mostly of those COVID patients, they have the lesions in the mouth, in the throat, and the skin rashes. So nowadays, they wanted to add it, to include in those like fever, running nose, in those symptoms now. So they just want to include it. They just want to add it because of what they have found regarding these patients, those COVID positive patients. I mean, 2 days ago, it was an update from the CDC.
That's, ma'am,
Okay,
another
but the vaccine, sorry?
That's added symptoms, madam? Ay, ma'am.
Yeah, added symptoms yun. So that's the additional symptoms from the CDC. They wanted to include it in the existing symptoms that they have given us. And the vaccine up to now, as they said, from when was that? 3 months ago, they said it's going to be 3 months this time. And yet still, we did not get any vaccine yet. Okay? So no vaccine yet available for COVID. Okay, so thank you very much. And now, thank you. Yes, ma'am.
Yung pong lumalabas,
Anything?
yung ma'am na gamot na sinasabi na sa Pilipinas, it's not actually a vaccine, ma'am. It is actually to remove all the symptoms. Di po ba? Yung pong yung mga antiviral, yung mga concoction po ng mga medicine na sinasabi sa Pilipinas na I don't know, starting with F, that medicine. So it's not actually vaccine, ma'am. It is just like antiviral, and then it's a combination of all the medicines to remove the symptoms, but not a vaccine, ma'am. Di po ba?
Yes. Yeah. Kung halimbawa Panadol is for the fever, the same thing. Yung symptoms ang tinitreat. It's not the virus itself. Because doon sa infectious disease, virus itself doesn't have any treatment. Okay, so because virus, not like the bacteria, not like the fungi or the parasites, virus has limit on their own. They have already, ano na yun? Yung, what is this? I forgot something about virus. So they don't have like the bacteria. There is, we have the antibacterial injection, antibiotics we are calling it. But the virus, we don't have because they are self-limiting. So once they have the 14 days, like the 14 days of lifespan, so within 14 days, automatically they will be off without even, going to treat them. So they have the self-limited. So there is nothing for them like antivirus. So they are just, treating the symptoms like fever, like for the pain of the stomach, so like this. But there is nothing like for the virus. Okay, so much for that. Thank you very much for that good information. So we have shared our research to everyone, and we have gathered some ideas, informations from every research that you have done. Okay, so going forward, I'm going to share with you our lesson for today.
Excuse po, I think Madge sent a message saying that she's on her way. She just had to go out really quickly, but she's gonna be joining us today.
Okay. Okay, fine. That's good. Wait a minute. Anak, paano to? Ba't hindi ko makita yung aking ano? Can you help me with this? Ba't hindi ko makita yung Zoom ko? Nag-hide. Ayan o. Dito. Anong gagawin dyan? Na-hide ko? Something? Wala eh. There is nothing to press. Ito, remaining time. Stop share. So, sandali lang po. Oo. Hindi eh. But if I will go, the same thing, hindi ko na sila makita. Naka-hide yun eh. O yan o, talking only. There is something that I pressed in. Teka, ayan o. Something na, ito siguro. Let me see. Aha. Wala pa naman si ano. Hindi ko. Yes, what's wrong? Okay. My point is ito, hindi ko siya alam makalaki. How to. Yan. Okay. So, nasa inyo na itong share code na slide? Nakikita nyo ba? Wala pa.
Nakikita po.
So, meron na tayong slide with you.
Yeah.
Level 1, ma'am. Infection control
Yung
level
page
1.
number 1 pala.
Okay. Okay, so we'll start. Our lesson for today is about infection control. Okay, so we have the learning objectives. What we want to know about infection control? We want to know the definition of infection and infection control, importance of infection control and prevention, roles and responsibility of infection control nurse and healthcare providers. How does infection spread? The chain of infection, breaking the chain of infection, standard precautions in control of infection and prevention, and information regarding COVID-19 and its preventive measure. So by definition, infection is the invasion of pathogens inside one's body. It is the invasion of pathogens inside one's body. And in infection control is the discipline approach with preventing healthcare associated infection. So we have the infection and we have the infection control. What are the importance of infection control in healthcare facility? Why we practice infection control in a healthcare facility? So number one, infection control in a healthcare facility is the prevention of pathogens or spread of microorganisms being passed from one person to another, patient, patient to staff member to patient, and staff member to staff member. So it's going to spread. It's being transferred from one person or from, according to Ma'am Paraluman, is also from animals to person, person to animals. The foundation of good infection control is to assume that everyone is potentially infectious. We only can prevent the spread of infection if we